Hello, I am Dr. Misty Miller, Associate Professor with the OU College of Pharmacy.
I'm Dr. Elisabeth Ponce-Garcia, and I'm an Assistant Professor in the College of Nursing, and I serve as the HSC OU Online and Quality Matters Coordinator in the Office of the Vice Provost for Academic Affairs and Faculty Development.
We are excited to tell you about updates made to All Professions Day curriculum earlier this spring, which included the incorporation of Resiliency for our OU and OU-HSC students. All Professions Day is a short series of introductory interprofessional education provided to students in their first year of their professional programs. We meet once in the fall and once in the spring for 2-hour sessions. We have hosted anywhere from 850 to 1,000 students, for which faculty, staff, and students serve as facilitators for interdisciplinary student teams. The program was pivoted to a Zoom delivery during the 2020-2021 academic year due to the pandemic. The majority of students and facilitators provide post-APD feedback, which our team uses to make alterations to future sessions. One activity that went well in person, the escape room, did not translate well to a virtual delivery, so our biggest priority was identifying a new teamwork activity. We also felt that it was imperative to include some element of mental health for our students who, like most people, are struggling with burnout and pandemic fatigue, but also allows us to meet the quadruple aim of healthcare to focus on the healthcare team's well-being. In order to meet these goals, we developed a new patient case and introduced the concept of resiliency for the healthcare team. Here you can see a snapshot of the agenda for All Professions Day 2, which was held virtually on Friday, February 25th. Students are introduced to the core competencies of focus for the spring, which are values and ethics and teams and teamwork. Next, students move to their small teams and breakout rooms, review the codes of ethics for the participating professions, and discuss similarities and differences. Next, they view a video case of a patient dealing with many health and social concerns along with an ethical dilemma. Our hope is that each profession participating will be able to contribute thoughts to the patient's care and discuss how to handle the ethics involved. Finally, students spend 35 minutes on resiliency training, which includes a micro lecture on the topic, a short cognitive test, a 5-minute mindfulness activity, and then a repeat of the cognitive test to assess whether the mindfulness activity changed their score. In the fall, we focus on the IPEC competencies of communication and roles and responsibilities for APD1. As stated in the spring, we promote values and ethics and teams and teamwork, although both sessions use all 4 competencies to some extent. Our ethical activity is intended to demonstrate that although we have different professions, the healthcare team generally has similar values. Our case and resiliency activities are meant to show students how to work within a patient-centered team and to provide and lean into the support a good team can give. On the next slide, you'll see a short clip of the patient case in which the patient, who is facing a cancer recurrence, is meeting with his partner and team about possible next steps when the ethical dilemma arises.
I want to know how much time I have if we don't do anything.
Gosh, we're going to get through this. Don't worry about it. I know we don't. I know. Just know we're not there yet. So
Yeah, I may be. I just want to hear all the options.
All right. Well, about the pain and stiffness, how about I get you in with occupational therapy and physical therapy?
The key message of the training we delivered during All Professions Day was that interprofessional teamwork means more than just collaborating with colleagues regarding patient care. Patients and family members are included as part of the team. And as the team grows, so does the complexity of communication and navigation of ethical concerns. There are increased risks to confidentiality and informed consent. The video case depicted a scenario in which a family member pressured the patient to pursue a difficult treatment because the alternative was a terminal prognosis. Additionally, the provider appeared to have identified a preferred treatment and was less open to discussing alternatives even when the patient requested such information. The takeaway was that unless each member of the team is working to promote patients' rights and discuss ethical concerns, the increased complexity may result in compromised patient care. Fortunately, Evidence suggests that better understanding of the interprofessional aspects of ethical decision-making may lead to both better teamwork and potentially improved patient outcomes, as well as improved morale in healthcare providers. After discussing ethical concerns involved within interprofessional care, learners viewed a micro-lecture about the benefits of teamwork for patients and providers in line with the fourth aim of healthcare team well-being. Although teamwork comes with increased complexity of communication and some differences in ethical considerations, teamwork is a key factor in supporting not only patients but also providers. When we engage as a member of a team, we develop connections with others that can help us regulate our stress response, locate resources in times of need, gain insight and perspective when facing a challenge, and plan ahead in unpredictable situations. Teamwork also provides a sense of security, reliability, and belongingness. Our stress response is very sensitive to the presence of resources and social support. So the benefits of teamwork extend to all members of the team, to include providers, patients, and their families. Within the literature, stress and trauma are identified as the result of facing a risk, threat, or challenge without sufficient resources for success. When the risk or challenge overwhelms the supportive or protective factors a person has at their disposal, stress response dysregulation results, and this may lead to an even greater need for support to overcome the challenges. But when we can draw upon the support of a team to develop confidence, belongingness, trust, and a sense of security, as well as sharing cognitive and physical resources, we are able to regulate stress response and keep the balance of support versus risk factors in check. In this way, teamwork within an interprofessional healthcare setting is a resilience-building behavior that extends its benefits to each member of the team to include patients, caregivers, and providers. After the micro-lecture, learners engaged in a self-assessment activity in which they completed an assessment of cognitive performance under stress both before and after engaging in a 5-minute mindfulness exercise. This activity was followed by a discussion regarding how even brief mindfulness may help to reduce acute stress. Feedback regarding the content and activities indicated that about 95% of the 760 learners agreed or strongly agreed that they had gained insight into the values of other health professions, that the case study provided an opportunity to engage team members in shared problem solving, and that the resilience activity allowed them to reflect on the importance of well-being within healthcare teams. More specifically, learners commented that hearing different points of view from different disciplines shows how important working on collaborative healthcare teams is. That learning how each profession approaches clinical and ethical situations was helpful in improving collaborative skills, and that focus on self-improvement is helpful in improving patient care. Also, that the curriculum and experience help to expand awareness through the sharing of experience, knowledge, and support. We plan to use the feedback to improve the curriculum and offer it again. The aspects of interdisciplinary and interprofessional teamwork that we discussed during this training, to include ethics and resilience, are areas of focus within interprofessional education. In the future, our team has considered creating a simulation to help learners gain active experience navigating these topics.
We are grateful to several members of the IEPA for their time and insightful contributions, and we'd specifically like to thank Sarah Cable, Margaret Robinson, Blake Lesselbroth, Jay Robertson, and the IEPA Curriculum Committee. Thank you so much for taking the time to listen to our project. We are happy to answer any questions you have.